Alrighty, well, good evening, everyone. My name is Meridith O'Connor, and I am the St. Louis Program Coordinator for the Myasthenia Gravis Association. Our Executive Director, Allison Foss, is also, she's on the back end of things tonight, but she will be present. For tonight's program, as you know, we have our first ever patient panel, which we're just thrilled to have. But before we begin, I wanted to share with you our topic for July so you can get it on your calendar. Kathy Logan with Alexion will be speaking on July 18th from 6:30 to 7:30 p.m. about the newly approved drug Ultomiris. And then make sure to stay tuned in with our social media and website for any programming updates that we have upcoming. Hopefully and most likely we'll have some upcoming in-person programming, but you know, we're just sort of feeling things out with COVID and just kind of moving with the trends of the situation. So hang in there, and hopefully we can appeal to all audiences. But so I'm just going to go ahead and get started here. I'm going to introduce our panelists, and basically this is just a really casual, informal conversation amongst MG patients. As we know, we're not just MG patients, we're people, and hopefully you can take something away, whether it's something in common with one of these patients or maybe something a little bit different that you didn't know. But either way, we're really excited, and we can't wait to talk to them. So let me first introduce you to Kacy Becker. Kacy is married to her husband, Kenneth, and has two daughters, Aaliyah and Kaylin. Did I pronounce those names right?
Alea.
Alea, okay. Oh, beautiful names, beautiful names. Her kids keep her busy with all those sports that they're involved with, and she also enjoys spending time at the lake, camping, and fishing. Kacy was diagnosed with MG 6 years ago, and although the 6 years have been proven difficult and with a lot of challenges, she's had a tremendous amount of support from her family, doctors, hospital staff, the MGA, and various support groups. So welcome, Kacy. So then we have Audrey Ford. Audrey is 39 years old, a mother of 3, and also has MG. Audrey's been exhibiting symptoms since she was 12 years old, but received her official diagnosis at the age of 13. Over the course of the year, she has undergone numerous treatments for MG and has had many ups and downs, but currently she's on the up and up. So her goal in life is to be happy, as healthy as possible, and to be of help to others when she can. So welcome, Audrey. All right, but last but certainly not least, we have Rich DeGeorge. Rich was initially diagnosed with ocular myasthenia in 2001. And then around 2006, it migrated towards to generalized myasthenia gravis. Unfortunately, he suffered a myasthenic crisis, resulting with having to live with a trach tube for a bit until 2010. But he's been free of that trach tube, which we're so happy to hear, and is on the up as well, I would say. So Rich is retired and living in Kansas City, Northland, and you probably have seen him on our various support groups virtually. So welcome, Richard. And do you prefer Richard or Rich?
It doesn't matter, whatever, either way.
Okay.
Answer either way.
Awesome. So we're just gonna, I've already kind of done some introductions, but if there's anything you want to add in terms of, I know I've introduced your name, and maybe just discuss where you reside, how you like to spend your time these days, whether that's working or extracurricular activities or being retired, and maybe go into the type of MG that you have, whether it's generalized, ocular, if there's a certain antibody that you know of. If not, no big deal. And then we'll go from there. Does anyone want to get started?
I can start.
Wonderful.
The type of myasthenia I have now is generalized. It started like Rich's ocular, and I've had it for so long, I don't know how many years. It was just the ocular symptoms, but at some point it was generalized, and I've had a couple crises, ended up in the hospital like once or twice. But for the most part, I've managed to, with the assistance of my awesome neurologist, stabilize my symptoms. I stay pretty busy with my kids. I have a son that'll be 18 in 2 weeks, so I'm preparing to send him off to college. My middle child, he is active in football and track, so that keeps me pretty busy. And then my 5-year-old is involved with ballet, so that keeps me busy. So I spend my time kind of chasing them around and taking lots of naps.
No kidding. Yeah, no kidding. And you also work, do you work like as a you were a counselor at one point, is that correct?
Yeah, so I was a substance abuse counselor and a clinical director for about 14 years, but recently with the pandemic, I wanted to do 100% remote. So now I work at home for a managed care organization. I'm a care coordinator.
Awesome. Very much needed.
Thank you.
Kacy, how about you?
Yeah, sure. I was diagnosed 6 years ago, and I was diagnosed with generalized myasthenia gravis, and it's definitely been a battle these years. I've had several crises and trying to get it all figured out, but I really do feel now that I'm kind of on a good road, got the medicines that I think are working and moving in the right direction. So I work from home doing accounting. So I've done that for like 10 years. So I've always been able to stay at home. And I have 2 children, and we literally chase them around everywhere. They baseball, softball, they play basketball, volleyball, track, picked up wrestling this year too. So
Wow.
something new, but that's pretty much what we spend our time with, being a taxi cab for them.
Oh, they'll appreciate it later on in life, right?
Yes.
Rich, how about you?
Okay, I was initially diagnosed in 2001, as you mentioned earlier, Meredith. I was driving to work one day, and all of a sudden, instead of seeing 2 taillights, I saw 4 taillights in the car in front of me. Sort of concerned me, so we ended up going to the hospital and got hold of a neurologist there, and they ran the blood test. They said it was ocular. Okay. And I stayed stable on that until 2006, and then I had a significant crisis at that time point. And it went to a full-blown myasthenia, generalized myasthenia. I've had one other significant crisis since then, which was 3 years ago, and I've had a couple of exasperations since then. But I'm real stable right now. As I say, I'm retired right now. I worked until the pandemic. And then after when the pandemic hit, I just retired. I just said, that's enough. It's time for me to slow down just a little bit. So doing that, and I keep myself busy. I've got a grandchild here in Kansas City, which is really nice. Oh. And then for exercising, I started about 2 months ago taking a yoga class, and I go there 2 to 3 times a week, which is really helping my strength a lot. So,
good for you. That's amazing. Seriously.
Doing that.
Go ahead.
And then it really made a big difference to me, I think. We're on a 2-week break right now, and we start back July 1st. And then I do reading, just go out to eat dinner occasionally, things like that.
Sounds like a good retired lifestyle. You know a thing or two. That sounds good, but that's really cool about the yoga. I always yoga is interesting because I feel like it requires a little bit of stamina, and sometimes I don't feel like I always have that. So I'd love to hear more about the yoga thing later on in terms of when we talk about how you day-to-day lifestyle and stuff. But so I think let's move on to our little treatment timeline. Some of you have already talked about it, but maybe Rich, you kind of were describing your treatment journey, but I would love for each of you to describe the various treatments that you've been on throughout the years, and feel free to focus on one or the other or whatever. Feel free to go as broad or as detailed as possible, just to get an idea of, you know, what it has taken to get your MG to quote unquote be somewhat stable. Maybe discuss side effects, and then also I would love for you all to talk about how your MG is currently managed today, because I think that's important. So anyone can take that question.
Okay, I'll start, I guess. My treatments probably have been a lot longer since I've had it for so long. The first treatment I recall getting was I initially received the thymectomy. They did a CAT scan, saw there was a tumor, removed my thymus gland. Of course, I was on Mestinon. I hated it. I still hate it. As a child, they didn't really trust me with the pills, so I was on a liquid Mestinon every 2 hours. For those that have taken it, I'm sure you know the side effects, the abdominal cramps, like slurred speech, like all type of things. So at some point I was just like, I would rather have the actual symptoms than the side effects of this medicine. I'm not taking it. So that was at like 14 or 15. I'm like, I'm not taking this. I was told that my symptoms were supposed to disappear after the thymectomy. That didn't happen. So I started taking prednisone, and then they gradually increased it. So all of a sudden, I was on like 60 milligrams of prednisone. You know, I was a teenager, so the hormones were raging. I was always irritable. So that really didn't help, but it did. It was a kind of a love-hate relationship that most of us probably have with prednisone. They then told me about IV immunoglobulin, IVIG. So I would go get that twice a week. Was from a small town in Southern Illinois. So I would drive to St. Louis, and it was like an hour away. So early in the morning, I'd have to drive in the car with my mom to St. Louis for an hour, get this treatment. I'd be there all day, have these side effects of nausea, but it worked. So, I was like, you know what? I'll take these side effects. This works for me.
And how often did you do that?
I did that twice a week, so Mondays and Fridays for, oh God, it was a while. It was quite a while. And then my neurologist at the time felt like, you know what, that's not working. So let's try something more. So then I received plasmapheresis. I had to be hospitalized for that. And they, from what I remember, because I was a child and they were trying to break it down to me in a language that I would understand. So I was told it just like took my plasma out and it would like clean it, I guess, to clean the antibodies. I'm not sure. I guess that worked along with the prednisone and the Mestinon. They then graduated me to pills, and I would cut them in half. So, I was able to somewhat tolerate them. That worked for a while. I grew up, became an adult. I did have a period of remission because I was on no meds for like 2 years. And I thought it was normal. So I'm just living life, not really doing what I'm supposed to do in college, doing what everybody else is doing. And then bam, here it is again, myasthenia gravis symptoms. That's when it was generalized. What did they do? I can't even remember all the treatments I've had.
No, yeah, that's
but
fair.
I stayed like on prednisone forever. I'm still on prednisone. At some point they decided, let's do IVIG again. So we did that. I later on became a diabetic. So the IVIG symptoms, the nausea and vomiting, I had to go into the hospital because, vomiting as a diabetic, you get ketoacidosis. So I started getting the IVIG in-house for 5 days. That worked. And then they told me about Cellcept, which was an immunosuppressant pill that I could take. I started having side effects. I was just like so tired and I would get sick like all the time. So they had to take me off that. I got thrush like so bad in my mouth as an adult. And they were like, yeah, you can't take this. So then they switched to Imurin, which is also a immunosuppressant pill. I'm still on Imurin. Of course, they played around with my dose of prednisone because now I have diabetes. And so that makes your blood sugars high. So it was just a constant back and forth. But again, my treatment team is like awesome. So they would always explain to me what they were going to do, how they were going to do it, the cost of it, the benefits, all of that. So my main symptom that would just like really bother me, because my generalized symptoms of my arms would get tired. So you learn to kind of live around that. I wear hairstyles that I don't have to comb my hair because I can't. So the double vision was the most disturbing symptom to me, because I would be driving with like literally closing one eye, which we know that's not safe. So I was told, hey, get these prism glasses. So, on days where I have double vision, I wear glasses with prism. So that kind of resolved that. Last but not least, I was introduced to a medication called Solaris. About probably 4 years ago, my doctor kind of slid it to me like, hey, they have this new med. And I was like, absolutely not going to try it, because she said it was like a chemotherapy infusion. So a year later, I was just so desperate because the symptoms got worse. I couldn't walk up my stairs. I couldn't comb my hair. I couldn't brush my teeth.
Oh, wow.
So I was desperate, and I was like, whatever you have to offer, I'll take it. But of course, the back and forth with my insurance company, the insurance company basically told my doctor, no, it's not medically necessary. I did have knowledge of fighting denials from insurance company authorizations. So I got on the phone with my neurologist office, the nurse, and I was like, hey, I researched it. This is what they need. This is what they need. Send them this. And so miraculously, they approved it in 2019. And I started Solaris infusions. It was a once a week infusion. It lasted about 45 minutes to get it. It was really, really expensive. I was told it's the fourth most expensive drug in the world, which it is because I saw that bill and I was like, oh my God. But it worked. It worked for about a year and then boom, it didn't work. So good old IVIG. I would do IVIG twice a week from home, 6-hour infusions each time. They work, but they have the side effects. And of course, I remain on Imurin and prednisone off and on. They increase it, decrease it based upon my symptoms. The IVIG stopped working, so I'm back on Solaris today. 20 milligrams of prednisone and 100 milligrams of Imurin twice a day. My symptoms are pretty well managed, I think. I do still have like a droopy eyelid. To me, that's no big deal. It's not worse than like not being able to brush your teeth. So that is the treatment that I recall. There's probably more that I forgot. But that's basically my treatment over the 26 years.
It's a very robust treatment plan, but honestly, first of all, thank you for sharing that, because one, I think it gives a really good illustration of the treatment protocol that many neurologists take. You know, start off with the Mestinon and then the prednisone, then you've kind of had it all. And you're able to speak to all that. I also really appreciate you speaking to some of those barriers to care, like having to drive to your infusions twice a week, all the way into St. Louis. I mean, those are the things that people who don't have myasthenia don't think about, right? They don't think about all the different things that are required of you in addition to having the disease. So yeah, no, thank you for sharing that. That was I think we've talked about this. We both have very similar journeys. And so, but I'm glad the Solaris seems to be helping you, and you're on a relatively good treatment plan right now.
Thank you.
Yeah, no, that's wonderful. Rich, how about you? What is your treatment plan? Did it look similarly different? What was your treatment?
It's similar, but a little bit different. First of all, when I was first diagnosed with ocular, I was on Mestinon and prednisone. And I just stayed on those two drugs from 2001 into 2006. Now I'm a little bit older than these other ladies. I was 54 when I was initially diagnosed. And then in 2006, I came down with an infection, which required me to be hospitalized. And thank the Lord I was, because that's when I had my MG crisis. And I had a crisis. I had to be, and I don't want to scare people because everybody's different. Please understand that. And I came out of it fine, but I had to be intubated. And I was intubated for like 7 days. They tried to pull me off the intubation tube, and then I couldn't breathe. So they put me back on. I ended up having a trach tube after they tried several other things. So about a month later, 3 or 4 weeks later, they gave me a trach tube. During this time when I was in the hospital fighting this crisis, they gave me plasmapheresis, several treatments of that, and then they started me on IVIG plus CellCell, as you had Audrey. I'm currently off of CellCell, and I was on IVIG from 2006 until 2 years ago when I migrated to Solaris. One of the things that happened to me was I couldn't swallow, I couldn't eat, so I had to have a feeding tube for 8 or 9 months. I was actually hospitalized for 6 months with this crisis, a pretty significant crisis. The only Side effect I still have, which I think is residual to that, is I still have some breathing issues. When I get exerted, I get a shortness of breath real easy. That's the only real side effect I'm really having from that perspective. Everything's stabilized pretty good. As I say, I had IVIG until 2020, and I started on Solaris. I was taking 3 days a month of IVIG at that time point. Now I'm on Solaris every other week, and that's keeping me pretty well stabilized. During that time period, I think it was in 2010, I also got a port for my IV treatments, which really made a big difference.
Really? How so?
Well, I don't have the bruise. Well, I didn't have the bruising and the ability to access veins in my arms. And I really recommend an internal port if your doctor would recommend it, because it made a big difference in my life. And
A lot of people talk about that. Yeah.
Every time I go into the hospital, I just tell the nurses I have a port. They access me and they provide all the drugs and the blood draws and everything from the port. And it's sort of, you really don't think about it, but it really does make a big difference. For right now, my current medications are, I take Mestinon 4 times a day. I take prednisone an every other day dosage of 20 milligrams, alternating with 5 milligrams every other day. I'd like to migrate down, but I haven't been able to do that yet. And I get Solaris every other week. And that's my current treatment regimen at this time point. And I'm feeling pretty good with it right now. Now, every time I go into the hospital, it seems like the standard protocol for me is to get 5 days of IVIG. And I've had that twice in the past 2 years. So
interesting.
And that does help me as far as it's concerned.
That's similar but different. That's really fascinating. It's interesting that you both are on Solaris.
Now I'm able to drive myself. I still drive myself now, fully functional. I drive myself to all my doctor's appointments, everything. So
pretty independent, all things considered.
I'm fully independent now. No fee. All that is in the past, which is a real blessing to me. So
right. I mean, no kidding. You have your life back.
Yes.
I'm sure that was so scary too. Being in the hospital is not fun at all. But then to, have to go through some of these serious things, it's scary, but it's the reality some of us have to face, unfortunately. But it's just so wonderful that you had a good care team and support system to get you over the hump, so to speak. And now you're able to, sit here and talk with us tonight. So that's just really wonderful.
The support system I had was fantastic, and that really helped.
The support system. Yes, absolutely.
Like the doctors I had and my immediate family and friends. It really did help.
I know it does. It absolutely does. So Kacy, you're a little bit newer, quote unquote, so to speak, to MG. What has your treatment journey looked like for you? I know we were talking a little bit earlier about your plasma treatments, but yeah, just fill us in a little bit about what your treatment plan has looked like over the years.
Sure. I kind of feel like Audrey, but just a condensed amount of time. So we've done several things similar. But when I first was diagnosed, they put me on Mestinon, and it just kind of proceeded to get a little worse. And then they added prednisone, and I had a thymectomy too. So they had the thymectomy scheduled. Once I got there, they decided to do Plex to try to get me stronger before I had the thymectomy. So I think I was supposed to do 5 rounds of it, and that wasn't enough. So they did a couple more, push off the surgery so that they could get me as strong as possible. They did the thymectomy, and then they followed it up with a few more rounds of the plasmapheresis. And then that was a really tough time. I was in the hospital, I think 45 days out of the 60. I was admitted 3 different times, but I just couldn't get over that little hump there. And so I would go back into the hospital and they would do more plasma exchange, They would do 10 rounds of it, send me home. 5 days later, I'd come back in the hospital, do another 10 rounds of it. Then finally at the end of it, they gave me, I think they put me on like 80 milligrams of prednisone and IVIG. They did like maybe 3 rounds in the hospital and then set me up for weekly IVIG after that. And I was very fortunate and was able to get a care team, and they came into my house to give those infusions, but they were very long. I mean, I wanted to say 8 to 10 hours probably by the time they did everything. I had a line put in my arm. I'm trying to think what they're called, a PICC line.
Yeah, yeah.
I had that put in because like Richard, I was so bruised and they couldn't even hardly get anything. So they put one of those in on my right side. I had IVIG I had that in and did IVIG for about 1.5 years. And then they switched me over to a sub-Q IG.
Yeah.
And so I was able to then start doing that at my house on my own time frame, kind of. And then insurance decided to stop wanting to pay for that. So I then went into crisis at the same time. And I think during that time too, like I had been on Imuran, but I was losing my hair and some weird side effects. So they took me off of that and was on CellCept. So CellCept, IVIG, and then we switched to the sub-Q. And then when insurance wouldn't pay for that anymore, I went into another crisis, ended up in the hospital, did the same plasma exchange several times, and was able to get out of that. And at that time, my doctor switched me over to Solaris and IVIG. And I was still always been on Mestinon. And then they, of course, bumped the prednisone way back up to like 80 milligrams. And I was doing okay on that for a while. And then the following year, I had another crisis and went into the hospital. They did Plex again. And for my thymectomy, they have to do like CT scans every 6 months, then every year to check on the tissue around it. And while I was in the hospital, I'm like, can we just get this done? Because I'm going to be here next week anyways for this. So they did. And they found a blood clot in my lung at the time. Oh and God. They attributed it to the IVIG. So they stopped IVIG, and they kind of got to a place they didn't really know what to do. We were doing the Plex. They weren't really improving. So at that time, I actually had a feeding tube put in as well in my stomach and had that. And they sent me home because then they wanted to start Solaris and rituximab. So we started Solaris up again and then rituximab. And Solaris was every 2 weeks. Rituximab, I think, was every 6 months. And so that was 2 years ago, roughly. And from there, we've spaced it out to right now I'm doing Solaris every 6 weeks and then rituximab every 8 months. And they're hoping that maybe the Solaris can be dropped altogether here before too long. I'm still on a low dose of prednisone. I'm on 5 milligrams of that, and I'm still on the Mestinon. They did add like an extended release one that I take at night too to try to help. But yeah, I've been on several, and
yeah. I mean, thank you for sharing that. I think what's really interesting, at least what I take from the three of you, and it's, because I'm always used to talking about my own illness and own MG experience, and when I hear this from an outsider, so to speak, there's so many things I take away, and that's one, the amount of different medications we all have to be on just to feel somewhat stable. Because I feel like a lot of times when I'm at the neurologist, I always sometimes feel like I should be feeling better than I am, or I'm meant to feel that. They make me feel that way sometimes, but it's nice to know that there's other people out there that are on multiple, different streams of medication, just to feel somewhat normal. And that's an unfortunate reality, I think, for us with myasthenia gravis, but comforting to know that I'm not alone in that. And then in two, you guys talk a lot about the side effects, I think, of some of these medications. And so I don't know if y'all are familiar, but as this current climate, we are in a space in the MG research where treatments are emerging and new therapies are arising, what is like, what would be like the end all be all drug? Like what would be like, what would you want in a new therapy, I guess? Would it be less side effects? Would it be, the route of administration be different? Would the time frame in which you take the medication? What are some of the things that stick out to you or that you hope for new emerging treatments that maybe we're lacking right now? Anyone can take that.
One thing I like about the new treatments that are coming out, like is it Ultimate
Ultramarine?
Ultimus and this Vivgard, is that instead of every 2 weeks for Solaris, my treatment should be every 7 to 9 weeks. I don't remember the exact dosage on it, but you can spread out the treatments, and that would give me more freedom and more, I don't know, it's quality of life. I don't have to worry about going to the doctor, going to the clinic every 2 weeks to have a Solaris treatment. I can schedule my time a little bit better. And that'd be wonderful from my perspective right now.
And that's something that I think, research and drug development absolutely needs to consider, and they do consider it. I think, sorry about that. The duration and what is required of us to get to our treatments, how long we have to stay at those treatments, and then there's just so much that goes into that needs to be considered. So great point. Audrey or Kacy, do you have any things that stick out to you in terms of you felt that current treatments are lacking, or that you hope to see maybe what the new emerging treatments have?
For me, it's side effects. Right now I am on Solaris, but I have a nurse that comes in and she does it. I work from home, so I'll just literally be working while she's giving my infusion. It's 45 minutes. But the disturbing part about Solaris for me was I had to get like 5 different meningitis vaccines before I could get it this time around. Last time I got it, I don't know if more research came out, but I got literally 2 meningitis vaccines, and it was like, here you go. But there's a patient safety card, and the doctor stressed it that drug rep even stressed it, hey, make sure you have this in your wallet. When I was working in the office, my coworkers had one, and there were these lists of side effects. If you notice this, and this, call 911 immediately. That's so disturbing to me, because I would love a drug where, there's minimal side effects, like a headache, a cold, that's feasible, but all these side effects that could come, so that would be my thing. It's just the minimal side effects.
Yeah, I think that's huge, because like you said, a headache or flu-like symptoms are a little bit different than some of the more serious side effects. And I think that's one of the trade-offs that we have dealt with myasthenia gravis treatments, is sometimes these side effects can be even worse than what we're already dealing with. And so I know that's something that they are working on as well. But great point. Kacy, do you have any thoughts on this particular?
I mean, what they said too, both of those are some huge things, but for me, it's just to feel good. I want to feel better than I have for the past 6 years. My life before MG, I could do a lot more, and that's where I would like to get back to. I have kids I'm chasing around. I don't have time to be tired and to take naps every single day, and that's the quality of life, I think, is my biggest thing too. I'm willing to deal with the Solaris treatments. I have to drive about 45 minutes to go do them. It's expensive, just taking the time out of your day and driving and gas and everything to do it. But I'm more willing to do that to have better results, and it's cheaper than a hospital stay for several days. So, but yeah, that's kind of my goal, is to the best feeling.
Another really great point that you make, and it's interesting to hear what we're willing to do versus what maybe some people aren't willing to do, or how the trade-offs are different for each person. I think it's so important for research and drug development to consider, because not everyone is going to be able to, especially with these gas prices increasing. I mean, sometimes that's just not feasible now. And so I think you make a really good point, though, about how that can impact quality of life. So it's like, while your quality of life is good, but it can be better. That's what I'm always telling the neurologist. I'm like, I have a pretty good life, but I know it can be better, right? Like, I wouldn't be coming back to you this many times if I didn't. But really insightful. Thank you all so much. We're going to shift gears a little bit and talk about just the day-to-day MG experience. I would love to know, and we've talked about this a little bit, but how your MG currently affects your day-to-day living. I know you mentioned about chasing the kids around and stuff like that, and even some double vision, but maybe instead of talking about that, maybe what are some things that have helped you along the way other than treatment options? Rich, I know you mentioned a good support system, good care team. Would you like to speak to that, or?
Well, basically, I find myself, of course, probably a lot of folks are like this. I have much more energy when I first get up in the morning.
Yeah.
So I try to get as much as I can done in the morning. And then if I get tired in the afternoon, yes, I will lay down. I'll take a half-hour nap, or not necessarily even take a nap. I'll just rest, and that rejuvenates me. So basically, planning my day. Don't try to overdo myself. One of the hardest things I had to overcome was the fact that I used to be the caregiver in my family and do everything. And now that role is reversed, and my physical ability is limited. And I know that now. And that mentally was hard for me to overcome.
Yeah.
I used to cut grass, do yard work, all sorts of stuff. And that's out the window right now. And that would be nice to be able to come back to. But, at the same time, what can I do? I figure, what can I do instead of what can't I do? And I just try to keep myself busy. And one other thing, as far as that long treatment for Solaris or these other drugs, and of course, I'm at a different stage of life, but I'd love to be able to travel more.
Yeah.
Now, I have to plan my trips around my Solaris treatments, basically. For instance, I went down to see my daughter who lives in Phoenix over Easter. Well, I planned my trip where I had my Solaris on a Tuesday, and I flew out on a Wednesday. And then I came back before my next treatment. And it'd be nice to be able to stay down there for 3 or 4 weeks or a couple of months instead of having to come back from a medical treatment.
Right. Make it feasible to get your treatments when you are traveling or something of the sort. Yeah.
Yeah, that's a possibility, but that's a lot of coordination.
That's what I mean. Make it better. That, someone needs to make it better for us, because it's a lot of self-advocating too on the patient part, which is not necessarily where it should be. But yeah.
I'm not sure I answered your question, but
no, you absolutely did. You absolutely did. You pointed out some really great points. Audrey or Kacy, do either of you have any maybe tips or tricks about things that have helped you manage your MG?
For me, I just I'll always remind myself, okay, today is a good Myasthenia day. Like, I can get up, I can fold the laundry. Like I shared earlier, I learned to kind of live around my Myasthenia because I don't really remember what life was like without Myasthenia. I was 12, so this is who I am. But I have had periods where I was able to comb my hair. I could take my braids out without having help, but I can't. So, I wear hairstyles where I don't have to do my hair. I'm transparent. Like, I let my family know, my friends know, hey, because it's a disease where people can look at you and say, well, you don't look sick. I've heard that so much. So I have to be honest, like, hey, I can't do that because I have a chronic illness. And just accepting it myself and not pushing myself, like Rich said, okay, today I can't go out and help cut the grass. I had that taste of normalcy for 2 years and I want it. So sometimes I do try to push myself too much and I try to go out in the heat. I'm not supposed to be out in the heat because it exacerbates my symptoms. So just reminding myself every day that today might not be a day I can do this. Tomorrow might be a day I can do it. and just pacing myself. My doctor told me something years ago, and I try to do it. I feel guilty when I do, but she said, take a 30-minute nap every day. I'm not gonna promise you guys that I do that, but I try. I try to lay down. I close my eyes a lot because I do have the drooping left eye. If I need to wear my glasses with prism because I have double vision, I do it. You know, I'm not ashamed anymore of who I am or what symptoms I have. And, you know, again, just acceptance.
Yeah, gosh. You guys both spoke to knowing your limits, but also still not sacrificing the person you are just because of MG. I think, you know, there's still stuff we can do. It just requires a little self-acceptance, that journey of getting to know, you know, mourning the loss of the old self and, you know, valuing this life that we have with this illness, in spite of all the things that we have to deal with. But Kacy, how about you? Do you have any things that, and it can be tangible or small or simple things, or it can be really broad, anything that's helped you along to help you manage your MG?
I think just pretty much piggybacking on what they said too, just knowing your limits. And you know, the heat is one thing that does it to me too. And that's what, I have a great support system. You know, my husband will be like, hey, you've been outside and it's hot, you need to get inside. And my mom's the same way. She's texting me like, hey, you know, like, how about you drive instead of walk, or, you know, different things, just like think about it and make sure. So I've got somebody constantly there. And just giving, I guess, being okay with having people do things for you a little bit too. Like, you can't do it all. And with 2 children and, you know, trying to keep a house clean and working a job and everything, like, if you have to hire somebody to come clean your house, so be it. You know, if you can do it, I mean, that's great. But things like that, like, I guess, spend your time doing the things that you like and enjoy, and, you know, get help with the other things too. And it is what it is. I mean, at this point, I'm like, I can't be ashamed of not being able to keep a clean house or different things like that. You just kind of just go with it. So
that is so true. I mean, you're speaking to a good support system, and also just tapping into resources. I think for a lot of people with myasthenia, it must be a personality trait, because I feel like we all have a hard time asking for help or letting go of some of that. I would say, you know, I'm pretty independent, but I definitely have to rely on people for support, whether that be grocery shopping or doing my laundry, like my mom helping me do my laundry. Like, yeah, I'm a 30-year-old woman who has my mom helping me do my laundry. It's like you have to get over some of that. I've had to get over some of that shame, or, you know, whatever those feelings that you feel when you get diagnosed with MG, and learn it's like, this is not our fault. You know, this is just the reality that we're living in. So thank you. You guys all have really different perspectives. So I'm just it's really great. I'm going to wrap up with a couple more questions. And I think if we have questions from the community, to see if they have any questions for you guys, either specifically or as a whole. But and this kind of goes with that last question, so if you don't want to answer this one, but what advice would you tell someone who is newly diagnosed with MG? What would you, when you were first diagnosed with MG too, what did you want to hear? Or maybe what is it that you didn't want to hear? Or as anything that you think someone, because we probably have people on this program that are just newly diagnosed with MG, searching for support, searching for answers, searching for any sort of thing that they can relate to. What Kacy, I'll start with you, because I've been going to you last for each question, unintentionally, of course. But what sort of things would you tell someone who is newly diagnosed?
I think the biggest thing is find a doctor you trust, and that, you know, is willing to walk with you through the journey, as opposed to just, oh, let's try this and throw this at you. Like, somebody that will be there with you and help you through it. And you know, just even support. There's several Facebook groups and different things you can get on, and you know, people bounce ideas out there of, have you tried this, or have you tried this? And not even necessarily that it will work for you or anything, but just knowing other people are in the same journey with you, I think is kind of a comfort. But yeah, just ask questions, you know, and ask. If you don't understand, ask. And I mean, your doctor should be able to help explain. I don't know how many times I've sat in the doctor's office. I'm like, I don't get this. I don't understand this. And he will take a piece of paper and a pen out and draw me some pictures. And granted, I still probably don't understand when he's done, but at least I kind of grasp some of the things. But that's, you know, that's the biggest part, is just asking questions and ask people that have it. I mean, we may not, it may not be the same thing, but at least we can sympathize with you and tell you. I know that was when I had my thymectomy, you know, newly diagnosed to this. It's scary. I mean, it's a scary disease that you don't realize. And there were scary symptoms that I had even before I knew I was diagnosed. And I know I reached out to somebody and they just gave even advice on what to pack in your bag when you're going to have your thymectomy, and like kind of what to expect and different things like that. And that was huge, just to know somebody else has been through it, and you'll get through it too. So.
Great point. Great point. Audrey or Rich, how about you guys?
Well,
oh, go ahead, Rich. I'm sorry.
Well, go ahead, Audrey. Go ahead. You go.
Oh, no, go ahead. I'll go last.
You're fine. Go ahead. I'll wait for you.
Okay. Like Kacy said, like I could probably write a book on like advice, but I won't. But like she said, just knowing that there are people out there that are living a functional life, you can still do it. It ripped me from going to school, being who I was. Sorry, I get emotional.
No, that's okay. It's our reality. Absolutely.
I was given a pamphlet.
Yeah.
At 12. Mm-hmm. And it had an old guy on it, you know, and it was like, this is Myasthenia Gravis. Nobody could tell me what it was. I didn't meet anybody that had it. The internet was not a real big thing at 12. So as I got older, I went to support groups, and it was like dire. You know, a lot of people in those support groups were homebound. They were on ventilators. And I was just like, oh my God, I'm not going to be able to live a normal life. And that doesn't have to be your reality. Like Rich, you know, that's so inspiring, Rich's story. But just know that there's hope. Like I have 3 kids that I had naturally. I went and got a master's degree. Like I got married. Like I live life. So you can live life. This is not a death sentence. This does not change who you are. To me, it helped me appreciate my life and not take a day for granted.
Well said, Audrey. I think, first of all, don't ever apologize for your tears, because those tears are real, and that emotion is so real, and that's so much. I feel it. We all feel it. And you know, every time I chat with you, I'm just so inspired by you, all of your ambition and ability to live a full, wonderful life and be a successful and independent person in spite of this disease that you were diagnosed with at such a young age. I think it also speaks to how far we've come, you know, now, and to have these conversations, open conversations, and all of us being really doing relatively okay and not necessarily on ventilators right now. And there's something to be said about having these conversations and what it does, what this sort of awareness does for not only just people in our community, but outside too. So thank you for being vulnerable and willing to share. It's appreciated more than you know. So thank you. Rich, how about you? Any wise words?
Well, I don't know wise, but Audrey, I went through a similar situation when I was initially diagnosed. As far as I was not given a pamphlet saying this is MG, but the doctor said you have myasthenia gravis, and both me and my wife looked at each other and said, "We never heard of this. What is this?" I never heard of the disease at all. But one of the things I've learned, I've tried to do over the years, is just educate myself as much as possible. Thank goodness we have the internet now. where we can learn about the disease and find out a lot more about it. But I try to keep up with all the advances that's going on with the new drugs and things like that. But I really did educate myself. And the other thing I've done is I feel like I've got a good medical network in that my neurologist and predominantly my neurologist and my primary care physician. If I have a question, I can either call them or I can email them and ask them the question. They'll respond sometimes within half hour, sometimes within a day of what my answers are. And I think that's important, both the doctor and the nursing staff. If you have that good rapport with your medical team, I think that really, it's reassuring to me to have that.
That accessibility to the experts is huge. I mean, it's just.
I feel real comfortable emailing. I don't do it all the time.
Sure.
But, you know, if I need to, I will email and ask them a question, and they'll get back with me. That's reassuring.
Yeah, that's a good care team. Someone that's got your back for sure. Someone that genuinely cares too. It's like, oh, this is not just, you're not just treating the disease, you're treating the patient, which is so important. So I think we're going to end on that note, just because I think it was a really powerful note to end on. But I do want to open these last 8 minutes for questions from the audience, if they have any. Again, I don't want to get into any like specific, like personal, like subjective questions about treatments, because like you said, you know, we want to make sure you're consulting with your neurologists and care providers about your treatment plan. And as I'm not a medical provider, and we are here to offer support. So, but just wanted to make that clear. Let's see, I'm going to look in the chat really quick. We did have a question about being on the ventilator. And I don't know if you know this or not, if you're able to see this, but it said, when you are put on a ventilator during an MG crisis, do they put you in a medically induced coma or are you conscious?
I have been on a ventilator twice during this journey. The first time was when I had my major crisis back in 2006. At that time, I was in the hospital, and I guess the best word to say is I crashed. I blacked out. And of course, they did all the stuff there, and they put me in they intubated me while I was blacked out. So I didn't even know it. The second time was 3 years ago. I had some major intestinal surgery, and they intubated me during that surgery. And my issues was trying to come off of the ventilator post-surgery. But yes, the answer is I did not know it until afterwards.
Interesting. Okay. Good question. Any other questions? Let's see. I'm also people are commenting about the treatment landscape. People want to eliminate the need of an MG pill form of medications and IVIG and not need the new treatment after initial loading dose, but once every 6 or more months. Yeah, I think that's a common interest among many MG patients. I don't want a new drug to manage symptoms. I want a cure. Well said. Well said. Any other questions for our panelists? We have about 5 minutes left, so I know they are willing and here to answer questions. Or questions just about myasthenia or the MGA or anything of that nature. Not seeing any questions. You guys must have just checked every box. All right, well, I will leave it at that. Then. Thank you from the bottom of my heart, from the organization, the MGA organization. I am so incredibly grateful to have had this conversation with each of you. I learned so much. I'm truly inspired by your resilience and just your ability to live full, robust lives. Oh, we have one question Q&A, but I'll finish my speech. I just wanted to say thank you. It's truly I know how hard it is to speak about this. Sometimes it can be a very vulnerable place to be in, but please know how appreciated and how grateful I am and the MG community is for sharing your experiences. There's so much value in sharing your story. So thank you so much. Allison says, fantastic insights. Thank you. Still waiting on one question on Q&A. Am I missing something? Oh, here. Probably not. I see it. Excuse me. What are some of the common triggers you have experienced? Anyone, if there's something that maybe you guys can speak to really quickly.
The heat and illness. So try to stay away from people that get sick, and try not to be out in the heat too much. Stress as well.
Check.
One thing
Rich,
I watch out for is infections. If I get an infection, I get sick real fast.
Yeah.
I came down with an infection about 6 weeks ago. I ended up being in the hospital, and 5 days of IVIG, I felt better. So I have to be real careful about that. And it's part of my autoimmune issue. So.
Right. Yeah. Kacy, anything for you, or just all of the above?
Heat and stress, those are about the two.
Gotta say the same. All right, y'all. Well, thank you so much. I hope you all enjoyed this as much as I did. I'm just really tickled. So thank you all again, and I hope you all have a good evening.
Thank you.
Thank you.
All right, take care, everyone. Bye-bye.
Bye-bye.